If you've dealt with a painful health problem and the pain didn't let up for days or months or even years, you know pain can permeate your life, put you on edge, and ruin your days. In your quest for pain relief, you may need to seek the help of a pain management expert. Here now is Dr. Vincent Carlesi, a board-certified pain management specialist and anesthesiologist who specializes in interventional treatment for chronic pain. How does a patient even know if it's chronic?
I think that if someone's experiencing pain for more than 3 or 4 months at a period of time, I would consider that a chronic problem.
And at that point, assuming they've already gone to a doctor, if not their primary care doctor, to try to sort it out, should they then seek further help with pain management?
Yeah, I think at that point, some assistance needs to be entertained.
If somebody is on pain medication and they find themselves continuing to increase the amount and increase how often they take it, is that automatically a red flag?
Sometimes. Patients need higher doses at times depending on their body habitus, depending on the type of pain they're experiencing. So it is a good idea to get assistance when you feel that things are getting a little out of control at that point, yes.
Now people may be wondering why we have a spine laying here, but you wanted to show us one of the interventions that seems to work for some of your patients.
Yes. Spinal cord stimulation is one of the techniques that I perform for patients that have chronic pain. It is utilized for patients that have had chronic back pain, past surgeries that have failed on the spine. And
the probe goes right into the spine?
Yes, it's placed by an epidural needle that's delivered under fluoroscopic guidance in a surgical center setting.
Okay.
So
and you feed it right through. Show us where you feed it.
Through the opening between the vertebrae and enters into the epidural space.
And at that point, the patient's spine has been numbed, so they're not even feeling this?
Correct.
And what that is then connected, obviously, to the battery.
Well, that's the implantable battery. There is a trial period for about a 10 to 12 day period that it's an external unit that is utilized.
Okay.
So this would be the final implant battery.
So if the trial run works, you would implant this into the patient's buttocks?
Yes.
And it would stay there permanently?
As long as the battery lasts, yes.
And this would then send the energy upward?
Correct. Into the electrodes that are inside the epidural space and stimulates the spinal cord to interfere with the perception of pain.
It's interesting to me because you would think any kind of stimulation would aggravate it.
Depending on the pain that you're experiencing, there are cases where it could aggravate certain types of pain. But the way we try to adjust the stimulator is to give it a low hum, so it sort of gives you a little white noise in respect to the pain.
Are you trying to distract the pain?
At times, yes.
That's interesting. So what is going on in the body that the pain intensifies at night, or it at least seems to?
I think at nighttime we have more time to feel our body experience, and we have less distraction.
So it really is a case of that? It's not a matter of blood flow at night or anything like that?
At times it is, but I think at night the littlest thing can interfere with your sleep patterns. So I think that we're more aware of things at nighttime, especially pain. And something like this device at a very low level can sometimes interfere with the pain enough that it's sort of soothing for you.
And I've understood that certain people their pain is alleviated by injections. What are you injecting, and who does that work for?
Patients who have spine pain from either arthritis or discogenic disease, we utilize a mixture of local anesthetic with a steroid-based material to try to reduce inflammation, try to interfere with nerve conduction. And it seems to help a lot of patients with that.
You're injecting cortisone?
A cortisone-based material, yes.
How often can that be done? Because people are so relieved by it. The question becomes, can they get it done every 3 to 4 months?
Depending on their medical status, you can have 3 epidural injections, which is one of the types of injections that we perform. Within a 6-month period, you can have 3 injections. And then at that point, depending on their medical status, you can reevaluate their status.
What are the side effects?
Swelling, fluid retention, at times immune responses, reduced immune responses. So patients who are diabetics can have issues with elevated sugars and increased risk of infection. So in diabetics...
Your body's just not fighting things well enough, perhaps?
Correct.
Can you get a cortisone shot in conjunction with steroids if you're on them already?
You can. You just have to limit the total dose.
Okay, you have to be real careful with all of this, I imagine.
Yes.
At what point does somebody need to be off those pain medications? If they go in for a surgery, they're in pain, but they're healing, at what point is it time to be off of them?
Well, it all depends on what's going on at that point. Some patients have issues with long-term narcotics and need to get off them as quickly as possible.
Within 3 months? Within 6 months?
3 months, I would say.
3 months, okay. That's a good guideline. Thank you so much, Doc. We're heading to a break here, but ahead, how to save your skin during these brutal winter days.
Once the cold air hits the skin, that's when everything goes wrong.
What you can do to prevent dry, cracked skin this winter. That's in less than 2 minutes, right here on 12 on Health.